Hello, my name is Dr. Dewan S. Raja. Today I will discuss about deep tendon reflexes, also called muscle stress reflexes. What are the deep tendon reflexes? These are the biceps reflex, brachioradialis reflex, also called jerk, biceps jerk, brachioradialis jerk, triceps reflex, patellar reflex, also called knee jerk, Achilles reflex, and clonus. Ankle clonus. These are the deep tendon reflexes. Now, what is a reflex? A quick, replicable motor response or movement provoked by a stimulus. What are the physiological reflexes? Physiological reflexes are normally present, may be increased, decreased, or lost in the disease process. What are the pathological reflexes? Pathological reflexes are not normally present but appear in a disease process, typically manifest as a sign of upper motor neuron lesion. As a sign of upper motor neuron lesion. This S should be out. Okay. Then we are looking at the reflex, how we check the reflexes. We should have a reflex hammer. Some physicians are more comfortable with long handle round end hammer, but especially by the neurologists, because they can easily strike by a long handle and round end hammer. Okay, so this is the biceps jerk. Ideally, patient should be unmindful or distracted, or they will not tight it too tightly, but rather they will have slight tension in the tendon. So here we will find out the tendon at the elbow band, tendon of biceps brachii muscle that is innervated by the musculocutaneous nerve. And this is the examiner's thumb, so there will be moderate brisk strike on the thumb, and we look, this thumb is over the tendon of biceps brachii. We look at the contraction of the biceps brachii muscle. Here is the supinator muscle does not cross the wrist joint, so it should be tested by the other end of this end of the wide end of the hammer here. Okay, and we look at the movement of the muscle, the brachioradialis. Brachioradialis does not cross the wrist joint. Okay, it end up here. Okay, we got that. And brachioradialis muscle is innervated by the radial nerve. Here, patient's hand is flexed here. Here also flexed. Okay, here is flexed, and it is dangling like that. And this is the tendon, the triceps tendon, and we look at the muscle contraction. We strike on the tendon, we look at the muscle contraction. Here is the ligamentum patelli. This is a continuation of quadriceps femoris tendon here. Okay, and we strike here and look at the movement of the knee joint. Okay, due to contraction of the quadriceps muscle. These are the vastus lateralis, vastus medialis, vastus intermedius, and the rectus femoris muscle. Okay, so they are innervated by the femoral nerve. Here is the tendoachilles formed by the gastrocnemius soleus muscle tendon plus the plantaris muscle tendon. Okay, here we strike here, we look for the action of the muscles. Okay, so that there will be movement of the ankle joint, by the contraction of the muscle here, and This indicates the tibial nerve. Here, in case of very brisk response, the examiner attempt to dorsiflex it, then there will be oscillatory movement, dorsiflexion, plantar flexion. This happen in case of brisk type of response, very brisk response. Okay, so that is the ankle clonus. Okay, so if we go here, we'll go deep tendon reflex biceps brachii muscle, nerve supply musculocutaneous nerve that is coming from the brachial plexus, and spinal cord segment C5, C6, triceps brachii muscle, nerve supply radial nerve, C7, C8 segment. We study the spinal cord segment. From there, we'll get the spinal nerve formation. Patellar knee jerk or quadriceps tendon here. That is nerve supply femoral nerve, lumbar 2, lumbar 3, lumbar 4. Spinal cord segment, we test the spinal cord segment, and we look at the Achilles tendon, tendoachilles, okay, or tendocalcaneus, we can also say that way, ankle jerk. Nerve supply tibial nerve, spinal cord segment S1, S2. Ankle clonus is tested in the, if the reflexes are hyperactive, there will be repetitive jerking plantar flexion as examiner stress on the Achilles tendon. So how can we grade the deep tendon reflexes? Grade 0, no reflex. Grade 1, sluggish or diminished reflex. Stage 3, active, expected response, moderately brisk reflex. More brisk is the grade 3 than expected, slightly hyperactive. Grade 4, reflex followed by jerking movement called clonus. Okay, here is the, we check the ankle clonus. Commonly, we check that. Okay, so these are the grading. So when we strike on the tendon, we'll give a brisk strike. It should not be too strong, it should not be too weak, and patient should be distracted, and there will be just slight tendon tension, not too taut of the tendons. Okay, deep tendon reflexes, muscle stress reflexes. We may have certain conditions, we may have hyperreflexia that is seen in upper motor neuron lesion. Upper motor neuron that is coming from the cerebral cortex to the spinal cord, or cerebral cortex to the brainstem, nuclei in the brainstem. Okay, lesion in the brain, cervical myelopathy, preeclampsia. In preeclampsia, overactivity of the muscle due to autonomic stimulation, plus there may be ischemia of the cerebral circulation. Tetanus caused by a bacteria that is called Clostridium tetani, and this may be the disease due to contaminated wound. Tetany is a clinical condition due to hypocalcemia. Okay, in this condition there will be hyperreflexia. Amyotrophic lateral sclerosis may have hyperreflexia because it involves both upper motor neuron as well as lower motor neuron lesion. Hyperreflexia may be found in multiple sclerosis that involves the neurons of the upper motor, that involves the upper motor neurons, multiple sclerosis. Hyporeflexia due to lower motor neuron lesion, a dorsal root or sensory afferent lesion affecting afferent arc or limb of the deep tendon reflex. A reflex has two components, afferent component, efferent component. If we cut the afferent component, there will be hyporeflexia. And that's all about the deep tendon reflexes. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.